Okay, welcome to Meditech CPOE training. I'm going to get started. So you log into Meditech, and what you want to do first is find your patient. So you go to EMR View Patients. You then can go to any location. You choose St. Agnes Hospital. You find Pediatrics, and these are the current inpatients on Pediatrics. I'm going to go ahead and pick a patient. And this is the patient that you want to look at. This was a hospitalization in January. This was a hospitalization in April. We'll pretend that it's April now and you're choosing this hospitalization. Okay, so this is your patient. You want to make sure you have the right patient. And one of the first things I want to show you is allergies. So you definitely want to review allergies. This patient has no food or drug allergies. If you need to change that, you hit the little blue eye up here and you can review or edit allergies that this patient may have, or you can enter new allergies. So let's say the patient has a penicillin allergy. You would start to type it. Some options would come up. You would and put in all this data, the type, the severity, verified, meaning that you did confirm this allergy. You can put the reaction and any comments that might be important. You would hit save to save that. Let's go ahead and do that. So penicillin, we'll say it was an intermediate hives. You may want to put more information, but let's go ahead and save that information and hit done. Okay, so now you can see that your allergies are up there. Obviously that's important. If you wanted to enter weights, make sure the weight makes sense to you. You can hit the I again, hit the patient data button, and then you can change the weight. Let's say that the patient is actually 35 kilos. Actually, let's make him 65 kilos. So I'm going to hit OK, done. And obviously if you make any of these changes, then hopefully that will update here. If you make any of these changes, definitely let the nurse know. And that's a very important theme. Anytime you order something, please inform the nurse so that they're on board with what's going on. That includes medications. Okay, so to look at laboratory values, you would click here, microbiology information, imaging, chest x-rays, all that stuff. You click these buttons here. But let's start ordering. Let's say you hit, this is the tab here, you hit orders. And let's go through, let's admit this patient. Let's pretend this patient is being admitted. We're now on order sets. This is how you would order individual orders here. But let's start with order sets. So you would make sure that sets are chosen. You would choose pediatrics, and there are several pediatric order sets that we've created. There's also some NICU order sets, which you're going to stay away from, obviously, if you're not in the NICU. So let's go ahead and click a PEDS admission. This is a general pediatric admission order set for every patient. You are going to choose this. So hit view when doing order sets. Don't hit select, hit view. It just makes things easier. So we'll go ahead and hit view here. And we are entering orders on a new admission. We'll let this load. And then this is the entire order set. Let's go through it. So the first question that you'll have to figure out is the patient going to be admitted to inpatient, or is the patient going to be placed in observation? In general, if you anticipate the patient will stay more than 2 midnights, that includes if the patient was in the ED in that midnight. as one of the midnights, then you would choose admit to inpatient. If you anticipate the patient will stay less than 2 midnights, I don't know what this is. I'm just going to click out of here. You would choose place in observation. It's not that big of a deal because we could always change it later. But let's say that you anticipate this patient's going to stay greater than 2 midnights. Notice this edit button is red. That means that you definitely have to click this because there are questions that you need to answer. Okay, so here's the admit to inpatient. Okay, priority, routine, date will be pre-populated, time will be pre-populated. Anything with the star you need to answer. So obviously you need to put in the patient's diagnosis. You would click this button and there may be diagnoses already down here for the patient that maybe they've had in the past. But let's say the patient has bronchiolitis. So I start to type in bronchiolitis. I choose that, I hit save, and now that's the patient's problem list, patient diagnosis. They may have another problem like, let's say dehydration, and you would want to put that into. So any kind of problem or medical issue you put in there. So bronchiolitis, dehydration, attending. So the attending on currently, let's say it's going to be Dr. Chinsky, and you click Dr. Chinsky, and he's the official attending that is managing you. Accommodation peds. So the patient could either be in peds or in the pediatric ICU level of care. You could choose either one. Team service, notice it's not starred, so you don't need to pick it. Pager number, if you want to put the pager number in, the nurses could choose that, although they usually know how to get a hold of you. My rationale for inpatient services, so this is asking why are you choosing an admission rather than an observation, so you can pick one of these. Inpatient only surgical procedure, failed outpatient treatment, complex disease process, or other, failed outpatient treatment probably sounds reasonable. You can also, I guess, hit other and say respiratory distress, concern for dehydration. I don't know. Okay. So all the stars are ordered, so I would hit OK. Okay, now let's just see what the place in observation looks like. I'm going to hit edit, so it's a lot less questions, okay? But it's still going to want to know the attending name. Now, code status, notice that there's a star here. Every patient, you would want to click this. Resuscitation, most pediatric patients are going to be full code. Okay, so you're pretty much always going to have to do that. It's going to be on a rare occasion, very rare occasion, when someone's not going to be full code. So you choose full code. Now here, okay, the next section, notice how I'm opening up these tabs. If you want to put any isolation precautions, you would choose from. Now notice the edit button is not red, so you don't have to. But if you wanted contact isolation or droplet, you could simply click that. You can close this up again. Now, monitoring. So this is kind of neat. So this is based on age. So you would ask yourself, how old is my patient? Well, my patient is 9 years old. So you would go to the 9-year-old. Okay, so this is 6 to 12 years. These are typical vital signs that are appropriate for a 6 to 12-year-old. So you could choose those vital signs, and if the nurse will notify you if any vital signs fall outside those parameters. Now take note, you can edit these if you think that the heart rate needs to go down a little bit, or you would want to be notified for something different. You can simply change that by hitting OK. So this just makes it easier, so you can click per age group, but you can also edit. Obviously, you should only choose one of these. If you choose two, it will not make sense. Okay, there's some other options. Continuous pulse ox if you want that. CRM if you want that, you can choose those. Activity. Bed rest. Activity is tolerated. Out of bed. Self-explanatory stuff. Nursing orders. Obtain a height and weight. Strict eyes and nose. Tracheal suctioning, or I might put in some clarifications for that. Not many. Oh, nasal tracheal suctioning. Okay, so you might want to put just nasal suctioning as needed. Although I think we probably suction too much. Or oral pharyngeal suctioning. Here we go. Again, always communicate to nurses exactly what you mean. Okay, so the next section is oxygen protocol. Notice it's red, so you have to choose something here. Maintain O2 sats greater than 95th percentile. I think when we go live, you're going to have more options here. But obviously, there should be some better options. Oxygen delivery device, if they have any. You can choose what they have. If they have none, hit none. Let's say they're on a nasal cannula and you want 3-liter nasal cannula at, well, nasal cannula, you're pretty much going to have to do 100% unless you have high flow nasal cannula. Let's see. High flow nasal CPAP, and then you can titrate the FiO2%. Let's say high flow nasal cannula 10 liters. If you didn't want anything, you didn't have to choose a delivery device. Diet, you choose a diet. Some of them are red and you'll have to clarify it more. Social work consult, if you choose that, it is red. Now notice you don't have to choose this, but if you do, it's going to want certain questions like reason for consult. Okay, some other nursing orders: insert saline lock, fluid boluses. Now, this is a, if you want a fluid bolus, this is a 20 ml per kilo bolus over 60 minutes. And notice that it calculates. Let's go into this and hit calculate. It's going to do 20 mLs per kilo, and it's going to have, now there, well, let me get out of this. So let's go to this calculate button to look at this order and edit this order. Now remember, we put in 65 kilos as the weight. Okay, it's not popping up here yet. I think if we refreshed it, it would. But his weight is 65 kilos, and it calculates 20 times 65 is 1.3 liters. Well, usually you're going to max out at a liter. This is maxing out at 500 cc's. And this is a safety check that Meditech has built in, because you would rarely want to give over 1 liter of fluid. So anything over a check, it's going to pop up this dose set warning. We'll look at this later too. And if you say, oh yeah, I really shouldn't give this much, we'll give a half a liter, although I'll show you why it's having a 500 cc max dose. But let's say, okay, we'll accept that half-liter bolus. I'm going to accept that half-liter bolus, and now it changed it to a 500 mLs or a half-liter bolus. Now the reason it maxed out at a 500 is because the only difference between these two orders is one is normal saline in a half-a-liter bag, and this one is normal saline in a liter bag. So it wants you to pick this one for children less than 25 kilos and this order for children greater than 25 kilos. Let's go ahead and try and order this bolus. Now initially it's going to come up with 20 cc's per kilo, which is 1.3, but that's going to exceed our max dose. We'll go into this calculate button and we'll try and enter it, and boom, here comes the dose, the safety net. Again, I usually don't give greater than a liter boluses at one time. and I'm going to accept this max dose that it wants. If for some reason you wanted to override this, you would hit override, but be very careful with that. In general, you're going to accept this max dose. And now we have a liter bolus. I'm going to go ahead and uncheck this one. So now we're giving this patient a liter bolus. Let's go down here. Do you want the patient on maintenance fluids? If you do, you can choose one of these. Here's dextrose 5% plus a half normal saline. Let's say you want that, and notice this is red, so there's something you have to answer, and it's obviously going to be the rate. Okay, so it has a couple different options. Let's say that you wanted 55. Well, there's not a 55 option, so you could just change it here, and that will work. So 55 mLs per hour IV continuously, and it says as needed, but that's just sort of to make sure that it's given continuously. And you can review the fluid D5 half normal saline down here. Okay, the rest of this stuff, there's nothing in these boxes, so you don't need to worry about that. You can hit OK. And again, it'll pop up. You can review. Your rate popped up right there, so you can review that. Okay, let's go down. Now, here are common medications for admissions. Here's Tylenol. Now, notice this dose popped up because it auto-calculated 15 Tylenol is dosed as 15 milligrams per kilogram per dose. 15 milligrams per 65 kilos. It chose 975, which I think is too high. So let's go ahead and calculate this dose, and let's see if it catches it. 15 mg per kg per dose Q4 PRN. Okay, and here's the calculated weight, 65 kilos. And it says here PRN, pain and or fever. So we'll go hit OK. Okay, boom. There's the maximum dose catch at 650 milligrams, which I agree with. I don't usually give more than 650 milligrams, so I'll hit OK, and now it's changed to 650 milligrams PO Q4 hours. Okay, let's go down some more. There's ibuprofen. Hopefully this will max out, although it may max out at 800. Some people like to give 800 as their max dose. Let's see what happens. No, it's 600, so that's good. I'll go ahead and accept that max dose. And it changed it to 600. You have Toradol, Ketorolac, Oxycodone, morphine. Now that's a big dose of morphine because, again, it auto-calculated to 0.1 milligrams per kilogram per dose. Now let's see if it will change the morphine dose. It may not. Well, yeah, it's changing it to 5 milligrams. So I'll say, yeah, that's probably a good starting dose. I wouldn't go more higher than that. And again, you can review it here. 5 milligrams IV Q4 hours. There's some other medications. Now Zofran's a little different. It's not really dosed as a milligram per kilogram dose. It's dosed as, if your child is 8 to 15 kilos, you give 2 milligrams PO Q8 PRN. If your child is 16 to 30 kilos, you give 4 milligrams. So this is a little bit different than other medications because it's ordered different. So you can, for patients that weigh this, that's what you use. For patients that weigh greater than that, that's what you use. And this is the IV Zofran. It's 0.1 mg per kg per dose Q4 PRN, nausea, vomiting. Now 6.5 is too high. Usually the max dose is 4, and it maxes out at 4. I'm going to accept that. Okay. Go down here. Here's some Miralax. Probably every kid needs a little bit of Miralax. 17 grams PO daily if you want or need that. Now vaccines. This is kind of neat. Let's was built into the admission set so that these vaccines can be ordered and ready on discharge. What we don't want to happen is delaying discharge because uh, ordering vaccines late on discharge or on the day of discharge and having to wait for pharmacy to bring it up. So you can actually order these vaccines if the child needs vaccines right here. Obviously, you need to obtain consent, written consent, and give them a vaccine information sheet. But here are the vaccines that you can order. So we strongly encourage, if your child needs a flu vaccine, it can be ordered. And then look what it says here. 0.5 mLs IM. And it should say that, let's see. Now it's ordered PRN because if you look in the comments, and do look in the comments for your orders, it says for patients greater than 36 months or older. So this is the flu vaccine for kids 3 or older. And then this is given prior to discharge after parent consent obtained. And obviously you want to communicate this to the nurse, but the nurses should know that these are given prior to discharge. I'm going to hit OK. Okay, now once you've gone through this order set, you may need to order additional orders, and that's okay, but these are the standard orders that every patient needs. Once you've ordered everything you need to order, then you hit OK. Now it'll load these orders in, and it'll check for errors or interactions. And now this notification popped up. This is for your Miralax, and it's asking, when do you want this medication given? Do you want it given right now, or do you want it given, which this is tomorrow at 10 a.m. It wants to know if you want this med now, or do you want this med scheduled, and the next time the scheduled dose for daily will be tomorrow at 10 a.m. Let's say, well, let's just give it tomorrow. We don't need it right now. I'll just hit OK for that one. Okay, this oxygen protocol, I guess this is just reviewing that. I'm actually not sure what this box is. Missing PCS directions data. So it wants something here. Please page respiratory with all your orders. So you or the nurse should page respiratory. I'm not sure what this wants. I'm just going to go ahead and cancel this. Okay, now this is really important. These are all the orders that you just ordered, and they're here for review. Notice that there are new orders. Admit to inpatient, notify provider, obtain height, basically everything that I checked and ordered. And this is really important, especially for medications. Please review to make sure these medications make sense by weight, make sense with your patient, and make sense with the dosing that the Harriet Lane uses. So it's okay. You still need to check the Harriet Lane, especially if you're not used to mgs per kg or medications that you're not used to ordering. Please review this. This is really important. Make sure it's the right patient and the right orders. So after that, once you've reviewed your orders and you're ready to go, you want these new green orders ordered, you hit save again. So it's asking a question, resuscitation in full code. Yep, duh, it's a kid. And again, here's one last chance to review your orders to make sure that they are the correct orders, they make sense, and that the dosages are correct. Notice that there's an effective, these will go effective now, but the Miralax will start to be effective tomorrow, the next day at 10 a.m. And that all these medications are ordered. Then you will put your PIN in and hit enter. It'll file the orders, and now the orders will go to pharmacy to start, so they can start making them up, and then into nursing. Again, anytime you order something, let the nurse know verbally, physically, let them know what you've done. Don't just rely completely on Meditech for them to find it. Very important part. Okay, so how do you get a PIN? Well, remember this, when you first log into Meditech, change your password PIN and change your PIN, and you can put in your password and make your PIN there, 4-digit, something that makes sense.